Hello, I'm Monica Hendrickson, the Public Health Administrator for Peoria City County Health Department, and welcome to our weekly Facebook update. In regards to the Tri-County, which includes Peoria, Tazewell, and Woodford County, as of Friday, September 11th, we are sitting to date at 4,482 cases. That includes 2,802 cases in Peoria County, 1,337 in Tazewell County, and 343 cases in Woodford County. Overall, we've seen an increase from the previous week of 426 new cases in our Tri-County region. That includes 254 new cases in a week for Peoria County, 134 new cases in Tazewell County, and 38 new cases in Woodford County. Between the Tri-County region, we report 57 deaths to date in our area. That is an increase of 3 from the previous week, with 1 associated to Peoria County, another in Woodford County, and today we're sad to report a 3rd death to a Tazewell County male resident of a long-term care facility in his 70s. Overall, 75% of our cases are considered recovered, while another 23% are at home and isolating, and just under 1% are hospitalized. This has been a decline that we've noticed in the past week, and we would continue to hope this trend continues through subsequent weeks. But with that, OSF St. Francis Medical Center, UniPoint Health, Proctor, Methodist, and Pekin are reporting 14 ICU beds currently in use and 38 non-ICU beds currently in use related to COVID-19. There were no new deaths to report in the past 24 hours. Overall, the Tri-County sees an average of 61 new cases each day. Peoria County specifically sees 36 new cases each day. And in our hospital systems, we're averaging right now 13 ICU beds each day and 47 beds total. We've had some kind of big news happen in the past week here, specifically related to Bradley University. Starting on September 8th, Bradley University imposed a 2-week quarantine for their students and staff. This really was put into place to stem an increasing positivity in regards to the students' population. Bradley University has been doing surveillance data. They've been randomly selecting students to be tested. Based on that, roommates, subsequent friends have also started testing positive at community-based test sites. We've seen that age range of 18 to 22-year-olds really increasing in terms of positivity. It's one of our fastest growing groups in our area. And so we applaud what Bradley University is doing. They're trying to get ahead of it. And by doing so, working diligently and quickly, the goal is that by the 23rd, they can reopen back up and come back online to where they were before. But again, they're going to continue to monitor this. We ask those students, though, that are currently in quarantine to adhere to those recommendations. Just because you test positive or you are in isolation or quarantine does not give you necessarily the freedoms to do other activities. The goal is that the virus goes from person to person. So by trying to close down that transmission loop, spread it out, we can get ahead of this virus in our community. The other larger news too is that Peoria County, along with Tazewell and Woodford, are 3 counties out of 20 as part of Region 2 in our state's Restore Illinois plan. We've been monitoring this because part of that plan looks at steps that need to happen whether we hit certain metrics. One of the metrics that we are measured against is positivity. And so while other data points include hospital admissions and hospital utilizations of ICU and beds, it's our positivity that we really need to focus on. We are seeing that our positivity is growing. In fact, in the past 10 days, we've actually had 4 days of increasing positivity. And remember, when we hit a certain threshold, especially 3 days at 8% positivity, we'll be transitioning into that first tier of mitigation, which would align us with what's going on in Region 4 as well as Region 7. And that includes the Will Kankakee area and then the Metro East area of St. Louis. Why we need to watch this and why it makes sense to understand kind of those steps taking place is that out of those 20 counties, currently 6 of our counties are in orange. And so we are really at a point where we need to get ahead of it quickly. And the way we can do this is rather easy. One is to minimize our interactions with individuals. So maintain social distancing, keeping that 6-foot radius away from someone, wearing face coverings, You might be an asymptomatic individual. You don't know that. And so with that, you can spread it unknowingly to someone else. So again, wearing face coverings is the key. If you do have symptoms, especially this time of year when lots of people think it's allergies, stay home. Get tested. This is key. Our contact tracers will tell you that oftentimes when we start asking individuals about when their symptoms started, they really got tested almost a week after their symptoms developed. That's a week in when they were exposing other individuals. So if you are feeling unwell, get yourself tested. Talk to your primary care provider. It could be allergies, but oftentimes it could also be COVID. So take the opportunity to use one of the multiple testing sites we have here in our community. Make sure if you do get contacted by an individual at a health department that informs you that you are a close contact of an individual that tested positive or is a probable case, then we want you to stay home and quarantine. Follow through with those guidance principles. The best thing you can do is make sure that you don't spread this to another individual. While there's a lot of individual responsibility in controlling this virus, we are doing it together so that we can make our whole community healthier. With that, I hope you guys continue to stay safe and healthy.